When evaluating any administration, a key question is how it protected public health. Public health demands respect for science, clear communication, and a commitment to safeguarding lives. Did the Trump administration empower health experts, or did politics override science? The answers have real consequences. We'll examine a former federal health official's first-hand account and a Texas measles outbreak to reveal the impact of political interference. By learning from the past, we can better prepare for future health crises. To truly grasp the events that unfolded within the walls of America's federal health agencies during the pandemic, we must look beyond the headlines and official press releases. The real story lies in the experiences of those who were there, people who witnessed the daily challenges, the mounting pressures, and the difficult decisions that shaped the nation's response. We need voices from the inside, those who saw firsthand how science, policy, and politics collided in unprecedented ways. These are the individuals who can shed light on what really happened when the stakes were highest. Recently, I sat down with a former high-ranking health official who served during the Trump administration. For their safety and privacy, they spoke to me anonymously, but their insights were candid and revealing. They described a system under immense political pressure, where every decision was scrutinized not just for its scientific merit, but for its political implications as well. According to this official, science was often sidelined. Data-driven recommendations, which should have guided the nation's response, were sometimes delayed, altered, or even blocked outright for political reasons. The process of reviewing and approving scientific reports became fraught with interference, as leaders weighed how findings might affect public perception or political standing. Reports were censored, with key information redacted or withheld. This left not only the public but also local health departments without the timely guidance they desperately needed to make informed decisions. The flow of information, so critical in a crisis, was disrupted at the highest levels. Inside the agencies, morale plummeted. Dedicated experts, scientists, doctors, and public health professionals felt their expertise was being ignored or undermined. Many described a sense of frustration and helplessness, as their work was overshadowed by political agendas. The official painted a clear picture. Time and again, political optics took precedence over public health imperatives. Decisions were made with an eye toward headlines and approval ratings, rather than the well-being of the American people. When you silence your scientists, you're flying blind in a storm, the official warned. In their view, sidelining expertise in favor of political expediency left the nation vulnerable, navigating a crisis without the benefit of clear, evidence-based guidance. In the spring of 2023, Texas faced a severe measles outbreak, one of the worst the state had seen in decades. Hospitals across major cities were quickly overwhelmed, with emergency rooms filling up as worried parents brought in children showing symptoms of high fever, cough, and the telltale rash. News outlets flashed urgent updates, and the city skyline was lit up with warnings about the spreading disease. The sense of crisis was palpable, and the need for a coordinated, science-driven response had never been greater. Yet, as the outbreak intensified, the dangers of political interference became alarmingly clear. Instead of empowering health experts to lead the response, some politicians stepped in, holding press conferences that downplayed the severity of the outbreak or questioned the recommendations of medical professionals. Behind the scenes, government officials interfered with the flow of critical information, sometimes even altering or withholding medical documents that could have helped local health departments act faster. The Centers for Disease Control and Prevention, or CDC, is typically the nation's foremost authority in fighting infectious diseases. But during this crisis, the CDC's voice was stifled by the administration. Just when their expertise was most urgently needed, the agency was prevented from sharing guidance with the public and local health officials. CDC scientists who had spent years studying measles and preparing for outbreaks found themselves sidelined. Their research and recommendations were delayed for weeks, as reports sat on desks waiting for political approval. Laboratories that should have been buzzing with activity were eerily quiet, and doors to critical facilities remained closed, further slowing the response. Staff cuts in recent years had already weakened the CDC's ability to respond quickly. Now, with key personnel missing and communication lines disrupted, local health officials were left in the dark. Meetings were filled with uncertainty, as city health departments struggled to make decisions without clear guidance from federal experts. The result was a communication blackout. Television screens that should have been broadcasting vital updates remained blank, and news anchors, lacking reliable information, could only speculate. The public, desperate for answers, was left confused and anxious. Meanwhile, the measles virus continued to spread. Children filled pediatric wards, and what should have been a preventable disease began gaining ground, infecting more families each day. The consequences of delayed action and suppressed science became heartbreakingly clear. This episode stands as a stark warning. When science is suppressed during a crisis, the problem only grows worse. Silencing experts and hiding data does not make a disease go away. It only gives it more time to spread. In public health emergencies, transparency and speed are not just ideals. They are essential tools for saving lives. Every minute counts, and every delay can mean more people getting sick. When politics block science, everyone pays the price. The Texas measles outbreak is a powerful reminder that in times of crisis, we must let science lead the way for the health and safety of all. As the outbreak worsened, local health officials in Texas were left to fend for themselves. Their pleas for CDC support were met with delays and bureaucratic obstacles. Communities with low vaccination rates, like some Mennonite groups, were especially hard hit. Local workers lacked resources for contact tracing, vaccination, and countering misinformation. Without federal coordination, containment measures came too late. The partnership between federal and local agencies broke down, leaving health workers isolated. This failure exposed the system's vulnerability when politics disrupts public health collaboration. The delayed federal response had tragic consequences. By the time help arrived, hundreds, mostly children, were sick with a preventable disease. Hospitals were overwhelmed, and at least 2 children died. The virus spread beyond Texas, turning a local crisis into a regional threat. Local officials, left to pick up the pieces, faced grieving families and shattered trust. The emotional toll on frontline workers was immense. This outbreak should have been contained. Instead, it became a case study in failed leadership. When science is sidelined, lives are lost. Misinformation fueled the crisis, compounding the damage of political interference. False claims about vaccines spread rapidly, amplified by prominent figures. Parents, bombarded with misinformation, delayed or refused vaccination. Some turned to unproven remedies, leaving children vulnerable. Trust in doctors eroded, making health workers' jobs even harder. The outbreak showed how misinformation accelerates public health emergencies. Without strong, science-based leadership, facts are drowned out. Fighting disease now means fighting disinformation too. In recent years, the Centers for Disease Control and Prevention, once considered the gold standard for public health leadership, found itself at the center of a storm. Political pressure from the highest levels of government created a crisis within the CDC, eroding morale and shattering the trust that staff and the public once placed in the agency. The atmosphere inside the CDC grew tense and uncertain, as employees struggled to reconcile their commitment to science with the demands of political leaders. The situation reached a breaking point with the controversial firing of CDC Director Dr. Susan Monarez. Dr. Monarez, a respected scientist, was dismissed after she refused to comply with directives that contradicted established scientific evidence. Her removal sent shockwaves through the agency, triggering a wave of resignations among senior staff members who felt they could no longer uphold their ethical responsibilities under such conditions. These departing leaders cited the implementation of dangerous and untested vaccine policies as a primary reason for their decision to leave. They warned that these policies put millions of Americans at risk and undermined decades of progress in public health. Rampant misinformation, both from external sources and, alarmingly, from within the government itself, further fueled their concerns. The spread of false information made it nearly impossible for the CDC to communicate effectively with the public, deepening the crisis. As a result, the agency was left weakened and vulnerable. Entire departments were understaffed, and critical projects stalled. The loss of experienced professionals created a vacuum that was difficult to fill, leaving the CDC struggling to fulfill its mission. Hostile rhetoric from political leaders and media figures only made matters worse. This inflammatory language fueled real-world threats against CDC employees, who began receiving threatening letters and facing harassment both online and in person. The The situation escalated to the point where a violent attack was carried out on CDC headquarters, forcing the agency to increase security and further disrupting its operations. Staff members felt betrayed and endangered by the very government they had dedicated their careers to serving. Many questioned whether they could continue in their roles, given the risks to their safety and the erosion of the agency's core values. The turmoil made it increasingly difficult to recruit and retain top talent. Prospective employees were wary of joining an agency in crisis, and those who remained faced burnout and uncertainty about the future. The damage to America's public health system was deep and lasting. The loss of expertise, the breakdown of trust, and the chilling effect on scientific integrity would take years to repair, leaving the nation less prepared to face future health emergencies. The chaos at federal health agencies had ripple effects nationwide. The CDC's instability weakened support for state and local health departments. The FDA's decision to limit COVID-19 vaccine eligibility, amid government skepticism, confused the public and eroded trust. Conflicting messages left people unsure whom to believe. Trust in public health is essential. When it's broken, collective action falters. Every measure becomes politicized, and the nation grows more vulnerable. A weakened CDC and distrusted FDA means slower, less effective responses to future crises. Political decisions today create lasting risks for everyone. The lessons from these crises are urgent warnings for America's future. Vaccination rates are falling, and public health budgets are shrinking. We risk seeing old diseases return if we don't act. Public health agencies must be funded and free from political interference. Combating misinformation requires clear, science-based communication. Rebuilding trust is essential. Without it, even the best science can't protect us. The health of every American depends on unity and a renewed commitment to science. If we ignore these warnings, we'll be unprepared for the next crisis. And in public health, that's not an option.